Hello, my name is Jeremy Rogge, and this is my medication administration demonstration. So first we're going to look at the med cards, the drug cards, to make sure that there's nothing bad about them. So here's my ibuprofen, front, back. Here's my furosemide, front, back. Here's my timolol, front, back. All right, so first thing we're going to do is check the physician's order sheet to the MAR. So we're going to check the patient. So Kathy Mearns, yes, perfect. The date is her birthday is July 25th, 1960, July 25th, 1960, perfect. We're going to check FIN number as well, 987-614-321, perfect, yes, they match. So, and then Dr. Brown is a physician, matches this one, matches MAR, and matches physician's order sheet, perfect. And then, just because I want to, I'm going to wash my hands as well. So then we're going to check our allergies as well. So codeine matches up, perfect. So then we're going to make sure that the drugs match as well. So first ibuprofen, right medication, yes. We're going to check right dose, 400 milligrams, yes, perfect. PO, orally, yes, this is the right route. Right time/frequency, 9 o'clock, and it's at 8:45 right now. So once a day, that's going to match up, perfect. Next we're going to do furosemide. So furosemide, right medication, yes. 20 milligrams, right dose, yes, perfect. PO, they match, right route, perfect. Twice a day, BID, and 9 o'clock is when we're giving dose, and once again, 8:45, so it's perfect, it matches. Timolol, matches. One drop, 0.5%, yes, right dose, perfect, matches up. Right eye to right eye, yes, matches up, right route. BID, this is twice a day. Right time/frequency matches up. 9 o'clock is when we're supposed to give it. And once again, 8:45, so it's perfect timing. So, wash my hands once again. Now that we've compared the physician's order sheet to the MAR, we're actually going to compare the drugs. So we're going to get our tray, and we can put away the physician's order sheet as well. So we're going to get our tray, we're going to get 2 of these cups here, furosemide and ibuprofen. We're going to get the pill splitter, because we're going to need that. And we're going to get our drugs out here. So furosemide, ibuprofen, timolol. So we are going to check our drug containers to the MAR. So ibuprofen, yes. 400 milligrams. These are 200 milligram tablets, so we're going to have to give 2 of them. These are tablets, so PO, that works perfectly. And we're going to check the expiration date as well. And we checked it, and we confirmed that it's not expired. Next, we're going to do furosemide. So furosemide, yes, it checks out. 20 milligrams, so these are 40 milligram tablets, so we're going to have to split it in 2. PO, and these are tablets, so it's going to be given orally. We're going to check for expiration date on this as well. And we've confirmed that it's not expired. Lastly, we're going to do timolol, yes. And it's ophthalmic, so we know that this is the right solution. 0.5%. Right dose matches as well. And we're going to check for expiration date. And we've confirmed it's not expired. All right. So now we want to prepare the drugs. So we're going to do ibuprofen first, and we're going to get our 3 labels. So we're going to do ibuprofen, and like I said before, we need 2 tablets of ibuprofen. We're going to do that. We're going to get 2 of those and put it in here. Right after preparing the medication, we want to create a label for it. So Kathy Mearns is the patient. Drug name is ibuprofen. Dose is 400 milligrams. Volume is 2 tablets. Date is January 5th. 50. Round. Signature JR EMSN2. And then we can do concentration as well. We'll just do 200 milligrams per tablet. Right, that was completed. Now we're going to attach the label to the container. not to the table. All right, that one's finished. So next we're going to do furosemide. So as I said before, these are 40 milligram tablets. We need a 20 milligram dose. So we're going to put it into this pill splitter. This is going to decrease it by half. So we're going to put it in the cap first. Yeah, just getting one. Put it in the pill splitter. Split the pill. And we got half there. And we're going to put it next in the modification phase. All right. So, right after completing that, we are going to make the label for it. And by the way, we're not putting the drug containers away yet. We still need it for the second check. So, creating the label. So, name Kathy Mearns. Drug name furosemide. Dose, it's 20 milligrams. Volume is half a tablet. Concentration is 40 milligrams per tablet. Date is January 5th. It's around 8:50. Signature JR UMSN 2. All right. After we created that label, we're going to put it right onto the drug container as well. So here's the furosemide drug container, and we're attaching it. Lastly, timolol. And because it comes into a dropper, we don't have to create anything. We don't have to get a different container. So we're going to bring the bottle, but we do have to still create a label for it. So once again, Kathy Mearns. This is timolol. Dose is 1 drop. Volume. And the concentration is 0.5%. And it's going into the right eye, so we want to make sure that we are writing that. That is the right route. Date and time, January 5th. Around 8:50 once again. Let's just write that. JR UMSN 2. All right. So now we've created the labels. We're going to do our second check. So to do our second check, we're going to compare the drug containers to the labels and the mark. So we will start with ibuprofen. So we're holding both of them. So Kathy Mearns, right patient, yes. Ibuprofen, 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 yes, it all matches. 400 milligrams, right dose, yes. So these are 200 milligrams, so we're giving 2 tablets. PO, so it's tablets, so it's the right route. And we're giving it at the right time, yes, because we want to give it around 9 o'clock, 30 minutes before or after. And yeah, and that's a completed check there. So then furosemide we want to check. So Kathy Mearns, right patient, yes. Furosemide, yes. Right medication. We want to give 20 milligrams, yes. Right dose, perfect. And we're giving a PO, so right route, orally. And then right time / frequency, 9 o'clock, yes. And we matched it up there as well. Perfect. So that one is all checked. And then lastly, timolol. So Kathy Mearns, right patient, yes. Timolol, ophthalmic, yes. Right medication, then right dose, 1 drop, 0.5%, yes, perfect. It matches up. Right eye, yes, we have the right route. And then right time / frequency, yes, we're going to give it around 9 o'clock. 8:50, yeah. Perfect. So we've completed the second check, but before I go in, we just want to go over what the drug is actually going to do. So we'll start with ibuprofen. So ibuprofen is an anti-inflammatory, it's an analgesic, mild to moderate pain, and it can help with, it's an antipyretic as well, and it's it can help with rheumatoid arthritis or osteoarthritis. It inhibits the synthesis of prostaglandins and inhibits COX-1 and COX-2. So safe dosing range is around 400 milligrams every 4 to 6 hours, and should not exceed 2.3 grams a day for giving it orally. So some side effects that we can see is some nausea and vomiting, constipation, GI ulcers and bleeds, inflammation of kidney, and stomach cramps. So some things we want to look for. We want to assess for GI bleeding and ulcers. Once again, we can look in the stool for that. We want to see if they're taking any anticoagulants because it's going to help the bleeding risk. We're going to assess for pain before administering and assess for pain after as well. And we're going to ask the patient if they have any renal impairment or bleeding disorders. Okay, so ibuprofen done. And then furosemide. So furosemide, it treats edema, it treats hypertension, it excretes water, sodium and chlorine and other electrolytes by inhibiting tubular absorption in the loop of Henle. The safe dosing range is 20 to 80 milligrams a day for a single dose. In children, this is kind of dangerous for children, but they cannot not exceed 6 milligrams per kilogram a day. So some side effects that we're going to see is dizziness, orthostatic hypotension, dehydration, and hypokalemia. So what we want to do, we want to assess BP before and after because it's supposed to reduce that. We want to assess the level of consciousness because the dehydration is going to deprove that. Decrease cardiac output, so we want to monitor the pulse to make sure that it's still strong. Some nursing education that we can see is we want to make sure they're not going to be too lethargic. We want to tell them to avoid standing quickly because they may fall over. And they want to eat foods high in potassium because you're going to be losing a lot of potassium. Lastly, we have timolol. So timolol is an antiglycemic drug. Treats high intraocular pressure so by decreasing fluid production and increasing fluid outflow. It's a beta blocker. So if it goes to systemic absorption, it's going to lower heart rate and lower blood pressure. So the usual range is 20 to 40 milligrams, maximum of 60 milligrams a day. So some side effects again, dizziness, hypotension, and if it goes to systemic absorption, congestive heart failure. And you can also, the side effect would be blindness in the eye. So some nursing implications, once again, we want to check BP and before and after, because if it is a systemic absorption, the blood pressure is going to go down. So then we want to check for cardiac failure too. We want to monitor the pulse as well. We want to see if there's any eye irritation, blinding / discomfort, and we want to see if they're wearing contacts because it can't be given at the same time as wearing contacts. All right. So we've completed that. So we want to make sure that we have everything, and we're going to put these drugs away first. So ibuprofen and furosemide we don't need anymore. We're going to bring timolol with us because it's going to be dropped in, and we're going to bring some water for the oral. So get some water. Perfect. And then we're going to bring cotton ball as well for applying the timolol. So now that we've got everything ready, we're now ready to go to our patient's room. So we bring the MAR, we bring our drug cards, and we bring our drugs. So as we go to the patient, we are doing a general survey to see if everything is safe, make sure there's no risk for falling. We're going to knock on the door. Hello, I'm Jeremy. I'm your student nurse today. We're going to wash our hands as we go in. I'm just here to administer some medication for you. All right, so then we're going to bring the table over. So that we have a good working station here. And first thing we want to do is just make sure that we're dealing with the right patient. So to do that, we are going to check their wristband. And in our heads, we're going to think Kathy Mearns. Kathy Mearns, yes, it checks out. July 25th, 1960. Perfect. It matches, FIN number matches, and the doctor matches as well. So then we're going to confirm with the actual patient as well. So can you please tell me your full name? You're going to tell us the name. And your birthday, please. Perfect. And any allergies that you have? If we ask for allergies, they're going to say codeine, most likely, but we just want to check for any other allergies that we might have missed. So I'm just going to do my last check before administering the drugs. So once again, we're just going to check the MAR to the labels that we've created. So first we're going to check ibuprofen. So ibuprofen, yes, matches, 400 milligrams, yes, matches. We're giving a PO, tablets, yes, that matches. And we're giving it once a day, yes, we're giving it right in the morning. And this is the right patient as we confirmed, yes, perfect. So ibuprofen is done. Now we're going to check furosemide. So Kathy Mearns, yes. Furosemide, right drug. 20 milligrams, right dose. We're giving it orally. These are tablets. Yes, it's the right route. and we're giving it twice a day, so 9 o'clock is the first time, and it's around that time, so perfect. And lastly, timolol. So timolol, Kathy Mearns, yes. Timolol, yes, that matches. 1 drop, that's the right medication. 1 drop, right dose, 0.5%, yes, perfect. We're giving it to the right eye, so we just want to check. We're going to give it to that eye here. Perfect. We're giving it around 9 o'clock. It's that time in the morning. Fantastic. So we're going to raise the patient up to our hip level, and we want to raise the head of the bed as well, because it's going to help. It's going to help taking it orally. All right, around 45 degrees. Okay. So we got to give some education to the client or to the patient. So we're going to give ibuprofen first. So this is an anti-inflammatory analgesic. It's going to help with your pain. Before we actually give it, we want to assess the pain as well. We want to assess for their basic vital signs as well. So if you're taking this home, just make sure that you're not leaving it around for children, because it should not exceed. You should not get this. So the side effects that you want to look for is nausea/vomiting, constipation, some stomach cramps, because that might show that it's a GI ulcer or bleed. Do you have any renal impairments? We want to check for some things, so like renal impairments, anticoagulants, because they could have interactions and this could affect the renal activity. We want to ask about bleeding disorders as well, because that could be bad.
I'm gonna make sure.
All right. So we've given them the education, and then we're going to give the drugs and some water.
If you feel any side effects that
Okay, perfect. So we've given ibuprofen. Next, furosemide. So furosemide is going to treat edema and treat hypertension. Some side effects that you might feel are dizziness, orthostatic hypertension, and dehydration, hypokalemia. So we're gonna assess blood pressure before and after to see if it's working, to see if they actually need it. We're gonna assess level of consciousness. Because of the dehydration, it may bring that down. We're gonna monitor their pulse after as well. We don't want cardiac output to be too low. And then if they're taking this home, we want to make sure that kids aren't going to get it as well. So we're going to tell the patient as well that they're going to expect a lot more fluid output, and it could cause lethargy, so avoid standing quickly because there is a risk for falling. And you want to eat foods high in potassium because you're losing a lot of potassium because of this medication. So once again, furosemide, here you go, and some water. Fantastic. So then last one, timolol. And this is ophthalmic timolol. We're putting it in the right eye. So we have the right eye, I just want to confirm that. So timolol is an antiglaucomic drug. It's going to help treat that. It's going to help treat intraocular pressure inside your right eye there. So some side effects that we want to look for is dizziness, hypotension, and possible congestive heart failure. Because if this is absorbed systemically, it's going to affect your actual CVS system and your vascular system. So then we want to, before we do it, we want to check blood pressure, and we want to check for cardiac failure, check heart rate, check the monitor. And what we're going to do is we're going to take the cotton ball, we're going to hold it right here, and we're going to ask them to look up. And we're going to insert it, and we're going to hold it here to make sure that it isn't absorbed systemically. All right. And we're going to ask the patient to close their eyes for 35 seconds. So once we've done that, we're going to tell the patient, we're going to be back around 30 minutes. We're going to leave you in this position because we want you to adjust the drugs. Call bell is right here if you need it. If you have any questions, you can ask me. Thank you very much. And we're going to wash hands, and we're going to do the MAR as well. So JR, UMSN2, JR, UMSN2, JR, UMSN2, and we're out of here.